Too many people spend the last 2 weeks of their life in the intensive care unit, in a place where they often never turn the lights off, with a tube stuck down their throat, around people who do not know them well enough to love them, and then they die. That can't be the way anybody wants to die. I can assure you it's not how I want to die. How can we change this? Our technology has outstripped our values. We have forgotten that dying is a part of life. We spend way too much time trying to extend life without thinking about what is the quality of life. Recently, I had the great privilege of having a conversation with Dr. Raza Diliwari, a cancer surgeon in Memphis, Tennessee, at the time of his own dying. Raza had been diagnosed with pancreatic cancer, and he knew that his prognosis was very poor. And yet he wanted to share with young doctors and patients and all of us his thoughts and views about dying well. I think you will find that this conversation is well worth listening to. It's something to help you think about, and more importantly, something to help you develop a plan around how you will die, and die well, just as Raza did. Most people have a real struggle to get to where you are right now.
Yes.
And I'm still trying to, what have you learned that the rest of us need to know?
Well, what I learned the most is you can't plan anything in that regard.
Right.
Things can hit you, and and one thing is inevitable, that all of us are not walking out of here.
I do think it's tempting as a family member to say, oh, maybe he'll be around one more month if we do this. And maybe if he does this drug, he'll make it to this event. But I now, in retrospect, I realize to watch him deteriorate more because he took that drug and just to be around wouldn't have been what he wanted anyway. And I think that translating weeks of life into what it really is kind of, this was kind of a reminder for me of what to tell your patients, what you think about when you say there's a 1 month survival benefit for a drug, and I think that's an important lesson.
So what did you think when you saw the metastasis in your liver?
My first reaction was, I got to get prepared. We all keep putting things away, and so I wanted to make sure that everything is easier for my family and my wife.
So from your clinical experience,
Mm-hmm.
what do you think your prognosis is right now?
Well, if I, just looking at this disease, the median survival, that means 50% of the patients are dead at 15 months. And very few 5 years survivors for this. So if I am in that lucky 50% to live 15 months, so it means I still have about 8-9 more months or so.
So most people would not consider that a very good prognosis.
No, it's not, but you can't change what it is.
It was a great privilege for me to have the opportunity to talk to Raza about dying when he knew he was dying. It's not every day that you get that chance to have a conversation like that. And so I want you to think about your own life. I want you to think about how you want to die. How do you want your family to understand your will? Use this as an opportunity to start planning. Start thinking about the ways you want to pass on your own values, your own ethics, your own way of seeing your life to your children and to your grandchildren.